Hey, Dr. McNamara here, and I'm coming at you with another Wellness Wednesday. I'm here at McLaughlin Care, and all I'm going to talk a little bit about today is this little guy right here, a herniated disc. So come check out the video and learn more about it. Hey, Dr. McNamara here, and I'm at McLaughlin Care, and I'm here to talk to you a little bit about disc herniations. So this is a very common complaint that we see in our office is patients coming in and they have low back pain. Sometimes it maybe is irritating that nerve that's associated with that disc, and it could be traveling down their leg, causing symptoms such as sciatica, things like that. So to start off, I'm going to start with a little bit of normal anatomy of a lumbar, of a lumbar vertebrae and disc. So this is the normal anatomy. This is what a lumbar vertebrae is supposed to look like. It's got a really big, thick body, and then in between each of these bodies is a nice, healthy looking disc. Now the disc is like a jelly donut, and I love jelly donuts. But what we don't like about this jelly donut is if it herniates, you can see in this model, it can come and it irritates these nerves back here. Now the reason it mostly does that is because we got a lot of ligaments and other structures here that it can't go forward. So when we herniate it and we start to bend forward and push, it pushes it back towards the spinal canal into those nerves, and that's bad. So what we want to do to treat this is we want to get that disc back to that normal height. You can see in comparing these two, this barely has any healthy disc space when this is a nice thick disc. So we're going to do that by performing a technique called flexion and distraction. And what that's going to do is it's going to pull apart the vertebrae, giving it more space. And then we're also going to be treating these joints back here, which are called facet joints, by giving them space by putting the body into flexion as well. So this treatment, what it looks like is we use a special table, and this table is specifically designed that it can bend. And this is going to allow us to do the flexion distraction. Now, bear with me a little bit here because I only have the model, but as you can imagine, there would be legs coming out here, and then we would strap the individual in, and then I would use a handle to go lift up and down on the table. But since we just have the spine here, I'm just going to use my hand. So what we want to do is we want to target the disc that is causing the irritation. In this model, it's that L4, L5 disc. So to treat it, what I would do is I would contact the spinous process, that's the pointy part in the back of the vertebra, and I would perform an upward traction motion. So I'm pushing up. And while I'm doing that, I'm then going to bend the table, and I'll bend it with my knee a little bit so you can see, and then that's going to give that disc that range of motion and that space. And then what happens is a reverse vacuum effect, where that jelly that's protruding out of that disc actually gets absorbed back in, and it stops irritating that nerves and gets rid of those symptoms of low back pain and sciatica. So if you guys, you or anyone you know is experiencing any low back pain that could be traveling down the leg, it could also occur in the cervical spine as well, give us a call, we'll do an examination, we'll determine the pain generator, and then we'll treat accordingly.